Well, let's spend some time talking about a therapy in development for patients with large cell lymphoma, relapsed and refractory diffuse large cell lymphoma. It's tafasitamab. Tafasitamab, otherwise known as MOR208, is a FC engineered humanized CD19 monoclonal antibody. Specifically, it's been engineered to have better ADCC than a native antibody. It's been going through several clinical trials, and so I think that this is an exciting new therapy. John, what's your take on MOR208? The data coming out is pretty exciting, I think, in terms of the data seen in large cell lymphoma when combined with lenalidomide. And what do you think about? Do you think we're really improving the ADCC with this antibody, or is it just the design of the trial?
Yeah, it's a good question. I'm glad we're not going to keep saying tafasitamab, but we'll call it MOR208 as you suggested. So thank you for that. Yeah, I'm excited about this drug. It's a real drug. It's a real antibody. It's definitely showing very encouraging data, as you mentioned. It's a little different as an antibody, perhaps. It's an FC humanized monoclonal antibody. So because of that humanized portion, that FC humanized portion, that perhaps it provides greater antibody-dependent cellular cytotoxicity, or ADCC. Certainly the preclinical data supports that. The proof's in the pudding. I would say it's clinical activity. And we know it's clinical activity in relapsed large cell lymphoma when you combine to lenalidomide, as you mentioned, appears quite encouraging. And I think the FDA kind of looks at it that way too, because they're granting accelerated approval pathway for that combination of MOR208 with lenalidomide.
Yeah, I mean, I'm impressed as well. We worked with it a number of years ago in the first in-human study in patients with CLL, and it was clearly an effective antibody. This was prior. This isn't CLL. This is prior really to BTK inhibitors and some of the new targeted therapies. And so I think the challenge was, as those were coming in, how to really develop it in that era. But the MOR208 investigators, I think, have done a great job of trying to build upon this this engineered CD19 antibody that has augmented ADCC and combining it with an immune modulating agent that lenalidomide. I think that was brilliant, honestly, and trying to build upon its strengths and bring it into patients with large cell lymphoma.